to a National Institute of Mental Health 2011 study, 20% of youth, during their lifetime, are affected by some type of mental disorder, significant enough to impact their daily functioning. More than 250,000 children in Michigan experience serious emotional, behavioral, and mental health disorders. Michigan is one of only 7 states without a general mental health parity law. All Michigan's children deserve mental health parity.
Families could breathe if Michigan had mental health parity. Families could breathe. They wouldn't have to stress about, can we afford therapy this week, or are we going to get groceries? Or they could do things that everyday families do. They could be normal families.
Over 50% of youth with mental health needs never receive treatment.
My daughter was first diagnosed with fibromyalgia, but then there was other things that came along. The diagnoses were so uncertain. There was Cushing's disease, there was rheumatoid arthritis, then there was generalized anxiety, severe depression. It seemed to be a tangle of things that nobody could sort out. And the response was some medications that were just heavy-duty kind of pain relievers that reduced her capacity to function. She was living in a nightmare.
The lack of mental health parity has meant that my son went for a long time without services and was not eligible for services until he reached the age of 16 and was eligible for Social Security insurance, and at that point we were able to also have him eligible for Medicaid. And once Medicaid was eligible, then we were able to access services.
Mental health parity will afford children access to mental health care as part of overall health care. Overall good health includes good mental health.
It forced us into bankruptcy. We were paying over 30% of our income was going towards Lindsay's treatment and services that wasn't covered by insurance, and we had to choose to either give her the best option to be successful in life or pay the bills, and we chose to pay for her services, but it forced us into bankruptcy.
Please don't tell these children and their families that their needs don't count.
I believe mental health parity is important to us as a society, collectively as well as individually, and that we have to take care of ourselves, mind, body, and spirit.
ACMH supports mental health parity. Join us in support of ending the discrimination.